And it looks like we are live. Hi, everyone. It's me, Hartley Logic here with Ultradent Products. And I am lucky enough to meet with Dr. Susan. I'm going to slaughter your name, McMahon.
You can do it.
I can do it.
Yeah.
It's a little bit of a hard last name for me, but we want to talk about immediate cash flow and treatment planning for your future. I kind of talked to Susan earlier, and she has some really great things that she's doing with her team right now and preparing for when they will open up again. Susan, do you want to take it away?
Sure. Hello, Hartley. Thanks for having me on today. I'm a clinical dentist in Pittsburgh, Pennsylvania, and I also do some teaching of dentistry. So I'm out and about once or twice a month. But I have a practice in the city of Pittsburgh with myself. I have a doctor that places implants in our practice, and then I have a general dentist. We have 2 hygienists, a couple dental assistants. Hygienists, yeah, a couple of dental assistants and some front desk people. So, we're feeling like everybody else is right now. We're completely shut down here in Pennsylvania. I know a week ago, our governor said only emergency care, and we still saw a few emergency patients a day. But really recently, he has completely shut down all dentistry in Pennsylvania. So we're a little upset about that and concerned, like everybody is, about not just our patients, but our team members and our financial futures, right? So we decided we did something last week that was really successful, and I'm happy to share it with everybody. We decided to take a look at our accounts receivable and our patients that we've had treatment planned. And because we're a cosmetic practice, we do a lot of kind of higher end dentistry, and we have a lot of cases that are significant financial investments for people. And typically we take a half down payment and half at finish, or a third. And so we have a lot of people that we're in the middle of treatment, and we also have people, just like every dental practice does, that owe us some money, that have a balance on their accounts. So we decided to offer those people a deal in order to stimulate a little cash flow for ourselves. We printed out all of our accounts receivable in ascending value, or descending value, I guess, the people that owe us the most to the people that had the lowest balances. And we started calling them last week and offering them a deal to pay us over the phone immediately. So it went kind of like this. My front office is doing it and is continuing to do it right now. We would it wasn't a script, because I don't like to do like full on scripts, but it gave us they sound canned, right? Mm-hmm. But we just wanted to be honest with our patients, and we told them that we are we're there for them for emergency procedures last week, and now we can't even say that, but I'm kind of checking in on them. And then we told them that we're concerned about the finances for the practice for the next few weeks and or months, and we sort of wanted to do something proactive about it. And we had a deal for them. Basically, we had an offer for them. So we offered them 20% off of their balances if they paid us on the phone via credit card, and we collected about $15,000. So it really helped our cash flow in just like a day and a half or so of phone calls.
And that's $15,000 with a 20% discount. And you are being authentic with your patients. You're telling your patients, hey, you owe this. We're offering this discount. We're closed right now. We're trying to reach out to you. Please help us help you.
Right. And a lot of people are still working and they're still having their paychecks. Unfortunately for dentists and people in the dental offices, we're not, right? We're totally shut down. And so the people that are still working were fine with that. And so many of them were glad to help us, and glad for the discount, and glad to pay us. And we, in our office, we use Weave, and I know lots of other systems are out there, but Weave is a system that you can text to pay. So we were able to text people. They paid us right on their credit cards. Some people use credit cards over the phone. I think the key to it was doing the math ahead of time. So my front desk had all of the reports ready. She had done all of the 20% off, so she was able to say, for instance, you have a $5,000 balance and we're able to offer you 20% off. And that's going to mean if you pay us today, it's $4,000. And that resonated with a lot of people, $15,000 worth of people in a very short time. So
yeah, seriously. And then along with being like, okay, I know this isn't going to last forever. At least I can kind of pay for some of this and get a discount because I know I'm going to do it in the future anyways.
Right. Well, this was for people that already had work done, that had already completed their work and still had balances for us. And we also, and we're working on this now, also have a report, reported out all of our treatment planning. And we're doing the same thing, offering people if they wish to proceed with their treatment plans. And we started with the people that were the most recent treatment plans, and we're working our way back chronologically. We offered them a 20% discount. And I mean, that has to work for your practice. Like you have to be able to, I guess, weigh it. Is losing 20% of the income worth having the money now? Or would you just rather wait and do it in the future? And for us, it felt better for me. It just felt more, more secure for me to have that income in the practice. And I know I can kind of, pay all our overhead and try to pay the staff what we can. And things like that.
Yeah. Speaking of your team and your staff, who do you still have on board with you since you're completely closed down in Pennsylvania? I remember you were telling me that they were letting you see emergency patients. You're not allowed to anymore unless you have a certain type of room. I can't remember what the word was.
Right, a negative pressure room and N95 masks, which
has a negative pressure room in the dental office. If you do, please drop a comment. I want to know you. We want to know how you got that room and what you did with it.
Because even hospitals don't have negative pressure rooms that I know. Like there's a few that do, but not too many. So it's a big concern here in Pennsylvania. So there's lots of people that are contacting our governor, and Organized Dentistry is really working on them, because all of those patients here in Pennsylvania that have emergent dental needs, and there are plenty of those, they have to go to the ER now. And was not the whole point of this not to clog up our ERs? So, as dentists, I think it was the wrong call. And I know they made it probably out of an abundance of caution, but it's time to reverse that and get dentists at least back in for emergency care in my state.
Yeah, and each state is probably a little bit different. Utah's different. That's where I'm located right now. I know we just had some other doctors on from California. They can still see emergencies, but all of these patients in Pennsylvania who currently cannot go to the dentist, are you doing anything special with your patients right now to kind of say, hi, we're here for you? Are you doing Facebook Lives? You're going on social media?
What are we doing for our patients?
Yeah.
Well, I'm a little bit on Instagram. I'm here, right, today with you.
Wow, look at you, Instagram user. I'm going to add you later.
Okay, Smiles in the City.
Perfect.
So I'm posting a little bit on social media, but not as much as I normally would, I've got to say. And we sent out emails to all of our patients, like so many practices did. And we are also, because of the Weave application, we're able to text them as well.
Oh, cool.
But I saw this idea on another Facebook group that I belong to, the Mommy Dentists in Business, and which is a group of mothers, dentists, practice owners, about 6,000 women, dentists strong, that Grace Yum out of Chicago runs. Amazing group, but and super active group. And I saw this idea there that someone suggested that we sort of reach out to our older patients just to check in on them. So we've been implementing that, and it's been, I think, really, really great for us as a team, and it's been good for them too, because I don't know about you, but being in my house, I've been here 10 days now, going a little stir crazy, right? Like we're all, a little edgy. And I think for some of our senior patients that may live alone or not have a lot of outside contact, they are super lonely. So we've been contacting them at least last week and this week, and asking if we can do anything for them. Some of them, don't have access to somebody to get their groceries. And I think it was a great idea, and I'm happy that we're doing it too.
That's amazing. My cute mom brought me, my sister wanted some sugar. I'm one of 7 kids. I'm from Utah. And my mom's like, hi, I have 6 bags of sugar for you. And we couldn't find any sugar in the grocery stores. I live across the street from a senior living center. So I gave them a call and I said, hey, I live across the street from you. I have a bunch of bags of sugar. If any of your senior citizens need anything, well, I'll go pick it up, and I have sugar on hand. I can drop it off. I dropped off a few bags. A few people needed it. And just that little bit can help one person just get over that hump of being in a stir-crazy environment, of just feeling uncertain in an uncertain world right now. And especially our senior citizens should not be going out in public if they don't have to be. So
exactly right.
You do is awesome.
Yeah, they are the most vulnerable. I love that you're offering them sugar from a dental company.
it was my mom gifted it to me, and I was like, I'm not going to use all this sugar. Like, I'm currently on the hunt for flour. I can't find
super funny.
But I had an overwhelming amount of sugar, and everybody needs a little sweet in their life, you know. You get a little sweet tooth.
Mm-hmm. I know it's certainly uncertain times, and I think we're getting bombarded with so much information, and so much of it is dire and negative that it's great that you can be like a little bit of a ray of positivity and sunshine like that. Exactly.
And calling your patients and letting them know, like, hey, we're thinking about you. Maybe they don't have anybody who's reaching out to them, and sometimes they just want somebody to talk to, and you could help them kind of turn their whole day around.
Yeah, I totally agree with you. And we have the time, right? We've got lots of time on our hands. My staff has been really happy to do that. They've really enjoyed doing that too. And because, anytime you're in a dental practice, your patients sort of become like family. You really get to know people. You spend a lot of time with them. You see them over the years. You hear about their joys and their kind of triumphs and their sadnesses. And just checking in can really mean so much to them.
I agree with you. Being a hygienist and you being a dentist, usually we're the first people to know when someone's pregnant. So they're like, I don't want you to take x-rays on me. And I'm like, oh my gosh, who knows? Only me. Like, I'm so lucky.
That's very true. And I know Gina Dorkman that he just had on touched on some other things that could be done during this time, like some positive things that you can do as a dentist and a practice owner. I know we've been working on updating our social media and updating our website. And I know she talked about that a little bit. And she said some things that I always hear, and I wasn't always clear about what that meant. When you talk about like updating your content or writing original content for your website, but it's really pretty simple that anytime you have any verbiage on your website, and so much of ours is copied and pasted from other websites or other sources. And anytime your website is like that the Google search engines recognize that it's content that's copied from somewhere else. So if you simply go to your website and read your content, whatever it may be, like for me, I do a lot of whitening. I do a lot of trauma work. Oh yeah, a lot of Opal Go and a lot of Opal Boost comes through my office.
Thank you.
You take your paragraph on whitening and just write it in your own words instead of whatever words that were on there. That then becomes original content, and that in itself is a really simple thing to do for us. It might take 20 minutes per paragraph, but that's what boosts your visibility in the search engines. Is just not having canned content.
Yep.
Just my little tip.
Pro tip from Dr. Susan.
Mm-hmm.
All right, Miss Susan, anything else you kind of want to go over with us, with our Ultradent followers? Does anybody have any questions? Thank you so much, Jacob. We appreciate your comment. I know you can see it, but I want to read it out loud. It says, I hope every dentist in America can see this Facebook Live and implement some of these fabulous ideas. Sending good vibes to all the dentists during these challenging times. Small business owners like you are the backbones of our economy. Thank you so much. Yes, we are. Yes, they are. We're in this together.
All right. Next time, I hope we're talking about clinical tips when we get together.
Me too. Definitely.
Okay. Right,
other than that, everybody have a great day, and we'll see you soon.